Well, thank you. Yeah, today I wanted to just sort of talk a little bit about the issue of men's mental health and why men's mental health in particular is important, some of the stigma associated with men's mental health, and some practical strategies that people can use to better manage mental health issues like anxiety and depression, and what you might be able to do if you know of someone in your life who you think might be struggling with mental health issues. So the first thing I want to talk about is just the scope and nature of the problem. Men's mental health issues are extremely common. At any point in their life, 1 in 8 men will experience clinical depression, and 1 in 5 men will experience a diagnosable anxiety disorder or anxiety condition. We know that depression is the leading cause of disability worldwide, so it has significant impact on people's functioning. And anxiety disorders are often associated with much higher levels of healthcare utilization. So people will often present to their family physicians with headaches or gastrointestinal symptoms like irritable bowel syndrome, chronic pain, those types of things. So why specifically men, and what's the difference between men's mental health versus women's mental health, and so why the focus on men's mental health? Well, overall, there tends to be more sort of overlap than differences between men and women with regards to mental health. But women are more likely to experience mental health conditions, and they are more likely to attempt suicide. However, men are more than 3.5 times more likely to die from suicide. So even though women tend to attempt suicide more often, men are much more successful at completing suicide. So they tend to engage in more lethal forms of suicide. And men are more likely than women to have comorbid alcohol and drug use associated with depression and anxiety and other mental health symptoms. Men tend to report lower levels of life satisfaction generally than do women, and men are less likely to access treatment for mental health conditions than women are. So they tend not to seek help or seek psychological treatment or psychiatric treatment until the symptoms of depression or anxiety are really severe. And so they tend to suffer with these conditions a lot longer than women do before they will seek help. And this tends to make it a lot more challenging to treat. The longer a person delays seeking treatment, the much more difficult it is to treat it. And these mental health conditions that have been there longer tend to have greater impacts on other areas of the man's life. So their relationships, jobs, performance, substance use, those types of things. So, what are some of the myths of men's mental health? And so there are a number of these myths. There are a number of things that contribute to stigma associated with mental health concerns or conditions in men. And one of the biggest ones is that people tend to see depression or anxiety as signs of personal weakness. Our society really tends to give a sense or to give messages of what masculinity should look like and what sort of a masculine man should look like. And so to sort of test this out, I did a Google image search of the term masculine men. And this is what came up. So you see the images are all of very strong, sort of powerful, sort of physically dominant men. And so that's kind of the message that's being promoted in our society, is that this is what masculinity and this is what a real man is like. Very strong, very powerful, very physically domineering. Other myths, things like, real men are able to control their emotions, and real men don't let life get to them, that real men tend to have greater fortitude, that certain emotions like sadness or anxiety, those are not considered to be manly emotions. Other myths, things like men should be able to cope on their own, that they shouldn't need to ask for help, that men should be able to figure it out on their own, and that asking for help is some sort of sign of weakness or failure on their part. And another sort of common one is that this perception that anxiety and depression can be overcome by sheer willpower. And that if a man's experiencing anxiety or depression, all they really need to do is to just try harder. And if they try hard enough, they should be able to overcome. And so that leads to what I like to refer to as the trying harder problem. So I want you to sort of think about this graph, and on the vertical axis of this graph, we want you to think about sort of levels of motivation and energy that a person has. And this is the level of expectations or goals that the person has for himself. And generally speaking, we tend to live our lives in this range, where our level of motivation and energy matches our level of expectations and goals for ourselves. So we're achieving the things we think we ought to be achieving. We have the motivation and energy to achieve those things. But then imagine something happens. Illness, relationship difficulty, challenges at work, job loss, those types of things. What does that do to a person's level of motivation and energy? Well, what it can do is it can cause that person's motivation and energy to go down. And so now the person is left in a situation where their motivation and energy is less than their expectations and goals of themselves. So the tendency is to just try harder. So my motivation and energy may be low, but I just need to try harder to achieve those expectations and goals that I have for myself. But if your level of motivation and energy isn't at the level that's required to achieve the expectations and goals, no matter how hard you try, you're not going to be able to achieve those goals. And what we know is that failure to achieve goals or expectations tends to sap motivation and energy. And so the motivation and energy goes down further. And so the temptation is, I just need to try harder. I need to just pick myself up by the bootstraps, just do it already. Come on, man up, just do it. And so I try really, really hard now in this situation, but my level of motivation and energy isn't where it needs to be to hit those expectations and goals. And so I'm going to continue to fail to achieve those things. And what that does is it just drives my level of motivation and energy further down to the point of, what's the point? I always fail. So this tendency to try harder, this expectation that men just need to try harder to overcome anxiety or depression, this can really just fuel a self-fulfilling cycle of failure and trying harder, but continual failure. So with that in mind, I want to talk about some of the consequences of these stigmas around men's mental health. So how these have a negative impact on men and their functioning. So think about traditional societal expectations, that sort of these ideas that men must be the breadwinners in the family, that as a man I need to be able to rely on myself entirely and I shouldn't have to rely on anyone else. So this notion of self-reliance, the problem is that it can prevent a person from seeking access to help. So if I feel that I need to be able to figure out and rely on myself for everything, and I'm having problems, I'm going to focus on me figuring out the solution to those problems rather than seeking help from someone else who may know more about how to solve those problems than I do. Other things that tend to come up is this perception that men must be strong, dominant, always in control. And so what this can lead to is a tendency to underreport symptoms. A man may not want to sort of talk about symptoms or difficulties that they're having, and this can make it a lot harder for a man to reach out for support from other people because they feel like they need to keep up this perception of strength and dominance and always in control. Men are typically not encouraged they're typically not encouraged to speak openly about how they're feeling emotionally. And for some, what this means is that they may actually lack the vocabulary to explain what they're feeling. So they don't even have necessarily the words or don't even know how to talk about how they're feeling. And so what this can do is it can lead some men to under-recognize problems that are actually present. Stigma around mental health and mental health difficulties in men can lead to feelings of shame, guilt, and fear about opening up. Now, this is particularly important and particularly stands out with relation to work. For a lot of men, they have concerns that their job could be at risk if they talked about mental health difficulties, or if work found out that they were having problems with panic attacks or experiencing depression. Similarly, it's often that men can have concerns that they could be held back from promotion if they mentioned mental health problems or admitted that they were struggling to cope from a psychological or emotional perspective. I work a lot with police officers, and this is something that comes up a lot, is that they're concerned about their ability to promote if their supervisor or their superiors found out that they were having difficulties with anxiety or depression. They may be perceived as being sort of weak or not as mentally strong, and then there's concerns about how might that affect my ability to promote. So the results of these various stigmas is that men tend to be far less likely to speak up about mental health difficulties that they're experiencing, and they're much less likely to seek help. They often deny the presence of problems, and it's common that men can rely on unhealthy coping tools such as alcohol or drugs to try and numb or self-medicate emotional difficulties. And so what ends up happening is you end up experiencing an unhealthy spiral where these things just kind of feed into one another to make the situation worse. So what are some of the symptoms of mental health difficulties in men? There's a lot of symptoms listed off here. These are not specific to men. These are symptoms of mental health problems more generally. And some of these may be obvious, some of these you might be fully aware of, some might actually be a little bit surprising. For a lot of people, they're not necessarily aware of the cognitive impacts that anxiety and depression can have on people. The impact that depression or anxiety can have on a person's ability to concentrate, to remember, to process information, to make decisions. So it's not uncommon when I'm working with people who are experiencing depression or anxiety, they feel like they're losing their mind, or they feel like they might have early onset Alzheimer's or something like that because they can't remember, they can't focus. And for a number of people, they're actually surprised to find out that those cognitive difficulties are actually a symptom of the anxiety or the depression. Other symptoms, these tend to be kind of more specific to men. Other symptoms of mental health difficulties, it can come out in terms of aggression, irritability, anger. It's almost like in terms of negative emotions, aggression and anger is an appropriate emotion for men to have, and so sort of our society is more sort of understanding or expecting a man to be sort of angry or aggressive, but there isn't that same level of acceptance of a man presenting as sad or sort of anxious or worried. Other symptoms, things like being overly sensitive to criticism or feedback, loss of their sense of humor, avoidance of emotional expression, essentially denying their difficulties. One of the most sort of startling instances I had of this was I was at the funeral of a young man who had committed suicide. And after the funeral service, I approached the young man's dad, and I was just checking in with the dad. I asked him, hey, how are you doing? How are things? Are you okay? And he just looked at me and said, no, I'm good. And it just sort of stuck out to me that here we are at his son's funeral. I'm asking how he's doing, and he's saying, I'm good. So clearly he's not good, but again, the expectations are deny the emotion, deny the difficulties, put up a front of everything's okay. Withdrawal from relationships is another common symptom that you'll see in men experiencing mental health difficulties such as anxiety or depression. Other things like escapist behavior, throwing themselves into their work, sort of non-specific physical problems, things like headaches, digestive problems, sexual dysfunction, pain. These may be symptoms that a person doesn't even connect to stress or psychological or emotional difficulties they might be experiencing. And then there's things like self-destructive behavior, so problematic gambling, substance abuse, sexual indiscretions, excessive gaming, unhealthy eating, those types of things. So what are some of the risk factors? What are some of the factors that tend to increase the risk of a man experiencing mental health or psychological or emotional difficulties? One of the most common risk factors is employment issues. So things like poor working conditions, high stress working conditions, excessive workload environments, but also lack of employment and retirement. These tend to increase the risk of depression and suicide in men, and particularly the retirement one. A lot of people don't realize the potential risk that comes with retirement, especially if the person has placed a lot of their self-worth or value in their job, and once they retire, they no longer have that, and they no longer have the structure and the routine to their life, and so this can really drive a person's mood down or contribute to emotional difficulties. Other risk factors, marital and relationship breakdowns. Depression is much more common and more severe among men who are divorced. Exposure to trauma, so combat, being the victim of an assault, workplace accidents, motor vehicle accidents, these all increase the risk of conditions like PTSD or depression. Legal or financial concerns. These tend to increase risk of suicide. So if a person's having legal difficulties or severe financial difficulties. Other life stressors like health problems, interpersonal conflict, the loss of a loved one. Social isolation is a big risk factor. So the more isolated a person is, the greater the risk that they're going to experience psychological or emotional difficulties, as is misuse of drugs and alcohol. So those are some of the problems. Those are some of the risk factors. So it raises the question of, okay, if I'm seeing some of these symptoms in terms of my life and sort of my functioning, what are some of the things I might be able to do to help myself? What are some of the things I might be able to do to intervene to make things better? And so to explain this, I'd like you to think about human experiences consisting of three main components. So there's the emotion part of human experience. And so most of the time when people come to see me for psychological treatment, it's because they're having problems with emotion. I feel depressed, I feel anxious, I'm having anger difficulties, those types of things. But we also think about human experience as consisting of behavior. What are the things that I do? How do I behave? And then there's the thought parts of this. So, how do I think about things? How do I perceive what's going on? And so usually people think about depression and anxiety as emotional problems. But the thing is, they interact with behaviors and thoughts, which then interact back into the emotion side of this. So think of this almost like the size of a triangle. And so imagine a scenario in which I wake up one morning and I'm feeling really down, I'm feeling really depressed. And think about how that might affect my behavior. Maybe I just stay in bed, I cancel plans with a friend, I close the blinds, spend the day either in bed or just kind of puttering around the house, not really leaving the house, not doing anything. And so, what are some of the things I'm going to be thinking about over the course of that day? Well, I'll probably be thinking about all of the things that I'm not accomplishing. I'll probably think about feeling badly about having canceled the plans with my friend. I'll probably think negatively about myself for kind of wasting a day or letting people down, not accomplishing things, failing at what I was supposed to be doing today. And so if I have some of those types of thinking patterns, how's that likely to affect how I feel? Well, it's likely going to bring my mood even further down. And so you get into this negative spiral. Now the spiral works the other way around as well. If I wake up one morning, I'm feeling really down, we know that people, when they're feeling depressed, tend to think in more negative ways. They tend to perceive themselves more negatively. They tend to perceive other people, perceive the future, perceive the world in generally more negative ways. So if I'm thinking to myself, I'm a failure, I'm a loser, there's no point in doing anything because things are never going to work out for me anyway, what impact is that going to have on my behavior? Am I going to go to the gym to get some exercise? Am I going to put some efforts into reaching out to friends and seeing about getting together with them? Well, probably not. And so my behavior is probably going to consist of me spending a lot of time alone and not really doing much. And so I'm not getting the intrinsic rewards out of those behaviors, which has a negative impact on how I feel and my mood. And so you can think of depression and anxiety as just kind of a series of negative spirals in which the emotional state has a negative impact on behaviors and thoughts. And so when I present this model to my clients, sometimes they can be kind of discouraged by this. They thought they were just coming in because they were having problems with emotion, but now it's a lot more, it's a lot bigger than they thought it was. But the key is this model actually gives a way out. So people don't have direct control over their emotions, right? We just don't, because if we did, no one would ever choose to be depressed. No one would ever choose to be anxious. We just choose to be sort of happy and carefree all of the time. So we don't have direct control over our emotions, but we do have control over our behavior and what we do. We do have control over how we think. And so the idea is to make behavior change and thought changes that indirectly get at the emotion, essentially breaking these negative spirals by changing one or two sides of this triangle. So just like they can work together in a negative way to make depression worse, if you make positive changes in your behavior, it can have a positive impact on how you think and how you feel. And so that's the key to sort of how do you break some of these cycles. Focus on the parts of the cycle that you can control. So what are some things you can do to help yourself? Healthy lifestyle. This is really important. So this stuff may seem obvious, but people, when they're experiencing depression or anxiety, aren't doing these things. So having a good diet, making sure you're getting exercise, having good sleep habits and good sleep hygiene approaches to sleep, paying attention to your personal appearance. I'll often work with clients and talk to them about what I refer to as the depression uniform. And it's those clothes that are usually really comfortable, but you know that if you're wearing them, you're not leaving the house. And so a person will spend the day in this depression uniform and they're not doing anything outside of the house. So things like as simple as, you know what, just get out of that depression uniform. Do your hair, shave, brush your teeth, get dressed. Because if there's even a little bit of a moment where you feel a sense of motivation to maybe go out for a walk, you're ready to go out for a walk. But if you're wearing your depression uniform and you feel a little bit of motivation to go out for a walk, it's just way too much effort for me to change or get myself ready to go out, so I just won't bother. Fun is a critical aspect of, and a critical and protective factor in terms of mental health. So we live in a society that tends to view fun as kind of childish or kind of a luxury or something that you do after all of your responsibilities and chores and tasks are done. But if you perceive fun that way, the question I always ask people is, has there ever been a point in your life where you stopped and looked around and said, I have no responsibilities right now. I have no chores, responsibilities, or tasks that I need to do. There will always be something. And so if you're putting off having fun, putting off building enjoyment into your life until all the chores and tasks are done, fun will never be a part of your life. And so it's really important to ensure that you're making efforts to build fun or enjoyable activities into your life. So you could join a social or community group, you can take up a new hobby, anything to try and build that sense of reward and things that you enjoy that aren't necessarily serving a purpose, but just you're doing them because you enjoy them. Social support is extremely important and can be an extremely protective factor in terms of depression and anxiety. So building and using your social support system is important. So communicating with friends and family, especially during stressful times. What tends to happen is guys will often be open and talk to friends and family when things are going well, but when things aren't going well, that's when they tend to withdraw and isolate. And that's exactly the time when it's really important to seek support from people. Let the people who care about you know how you're feeling. Let them know, let them in, let them know what's going on for you. Because talking with others, it builds empathy, it builds camaraderie and support, which these are all things that can buffer against the effects of stress. One of the things I'll often hear from clients is that they don't want to be a burden on anyone. And so they don't want to tell anyone what they're going through because they don't want to seem like they're complaining or they don't want to bother somebody. But then I always flip it on them and ask the question, okay, well, suppose you had a really close friend who was going through a really difficult time, and you found out later that they didn't approach you when they were going through the difficult time because they didn't want to be a burden on you. How would you feel about that? Would you say, yeah, that's great, thanks, because I didn't want to help you? Well, no, probably not. You'd probably kind of feel badly. You'd probably feel badly that they didn't feel like they could come to you. That it's almost a bit of an honor that someone would come to you to seek support. So it's really important to seek support and understanding and trusting that if these people care about you, then they're not going to see you as a burden. They're likely to want to help, and they're likely to be very understanding and honored that you've come to them and that you trust them to share this information with them. Other things you can do, consistency in your daily routine. So trying to ensure that you're eating and going to bed at the same time, that you have regular scheduled activities sort of throughout your week. Going back to that issue of retirement, this is one of the things that tends to make retirement such a risky time for people, is because they lose that sense of routine. Now I don't have to wake up at a particular time. I don't have to be anywhere. I don't have to do anything. And so that lack of routine can really drive low mood and depression. Having realistic expectations about your performance and your mental health in general, recognizing that no one is immune to stress. So sometimes I'll see people, especially sort of high achieving people, just keep pushing and pushing in spite of like stress upon stress upon stress. And it's almost like they feel like they're Superman, that it's never going to get to them. It eventually does get to them, and it eventually does get to everyone. So recognizing that you can't just constantly be exposed to stress and not affect it and not expect that it's going to affect you. And then they're seeking the right type of therapy for you. We know that, again, these are generalizations, but men tend to want to participate in therapy that focuses on fixing the problems, not just talking about them. So they tend to be less interested in sort of supportive counseling, and they tend to be more interested in what do I need to do? Sort of tell me what I need to do. How do we fix these problems? So more of an active form of therapy as opposed to sort of talking and reflecting on what's going on. This slide is sort of the what not to do in terms of helping yourself. So don't isolate or withdraw from other people, like I mentioned before. Use that social support system that you have. Seek support from friends and family. Limit your use of drugs and alcohol, recognizing that if you're using substances to self-medicate or to numb negative emotional states, it's not really helping the problem, it's just making you not feel the problem. But if you're constantly relying on these, there comes other problems associated with them. I talk about the importance of social support. Not all social support is created equally. So reduce or you limit your exposure to toxic relationships and toxic people in your life. So if you find that there's people in your life who are really draining or really challenging, try to limit your exposure to them as much as you can, because we know that can take a lot of the fuel out of the tank. And don't make major life decisions when you're in crisis. Sometimes people will say, okay, I'm just going to quit my job, or I'm just going to move away. Wait until things settle down a bit. Wait until you're feeling sort of more emotionally stable or balanced before you make major life decisions. One thing you can do is seek input from people that you trust in order to help guide you a little bit with this. So those are some things that you can do to help yourself if you're experiencing symptoms of anxiety, depression, emotional difficulties. But what about other people? What if you notice there's a guy in your life who you're thinking might be having some difficulties or problems, or you're noticing isn't quite themselves? What are some things that you might be able to do to help with their psychological or emotional difficulties? Well, the first thing you can do is to educate yourself about the signs and symptoms that he might not be doing well. So some of those symptoms I talked about in an earlier slide. Looking for any changes in his behavior or mood. So if you notice he's more irritable, or if he's more moody, he's withdrawn, or you notice that he's drinking a bit more. These might all be signs that he's not doing well. Encourage him to seek help. If you notice that he's having problems, tell him what you've noticed and explain why you're concerned about it. Offer to find information or resources for him. I know it can be easy to just sort of avoid or try to ignore these problems and hope that they just get better. And that's what people can often do. And you see this a lot with spouses, is that they'll ignore problems for the fear that it might just upset them if they bring it up, or it will just start another argument if I talk about, I've noticed that you haven't been yourself lately, and it just leads to a big fight. It may be tempting to just avoid those discussions, but it really doesn't help if there's a problem there that's not being addressed. If you're encouraging him to seek help, don't use labels like anxiety or depression at first. People don't want to be diagnosed by a friend or a loved one. They don't want to hear clinical terms coming from people who aren't their therapist. So talk more about the behavior as opposed to what emotion you think or what psychological condition you think they're experiencing. And don't make ultimatums to seek treatment. Don't say, hey, unless you go to treatment, I'm leaving you, or unless you go to treatment, I'm not going to talk to you anymore. That type of stuff, it doesn't work. You're not going to motivate him to seek treatment by threatening him. Be there to listen without judgment, without providing advice, without providing an opinion. This is far easier said than done, but it's really important because you're not going to be able to will or convince him to feel better. And sometimes all he needs is just somebody there who he can talk to and just vent to without, oh, well, maybe you should try this, or in my experience, this could work. He may just need a person to listen to him as opposed to just solve his problems or give him advice that he may already know. Yeah, I know I should be getting more exercise, but I just want to talk to you about the difficulties I'm having. Provide positive reinforcement. Acknowledge his positive qualities and why you care about him. If you notice any improvements or changes that he's making, encourage those efforts. Make a note of them and let him know so that he knows that other people are noticing. It's not just him making these changes, but that they're apparent to others. You can offer help in practical ways. So offering to give him a ride to or from appointments, maybe do some grocery shopping for him, making a meal for him once a week and just sort of dropping it off at his place. You can make plans to get together, to do things. It's a lot easier for someone if they're experiencing depression or anxiety. It may be a lot easier to sort of go out for a walk if somebody invites them to that as opposed to them having to self-motivate. So the key with this is don't force or don't push him to do something that he doesn't have the motivation or energy to do, but make the offer. Invite him to go for a walk or a run, to go see a movie, or to go grocery shopping together. Like do some of those daily activities, but just doing it together. Check in with him regularly. Make an effort to text or call him regularly. Be available if he wants to connect with you. And the key is don't take it personally if he doesn't respond. So don't feel like, oh man, he's ignoring me, or he may not be ignoring you. He may want to talk to you. He may want to reach out to you, but he just doesn't feel like he has the energy or motivation to do it. It isn't about necessarily the connection, but just letting him know that you're there. Because just knowing that you're there and that you care about him can be a really protective factor for him, can be a really important thing for him to know. Okay, so just wrapping up in terms of some resources, if you're interested in learning more about mental health issues, mental health conditions, strategies to help deal with or overcome mental health conditions. I've got a YouTube channel where I've posted now over 70 videos on a variety of topics like depression, anxiety, PTSD, OCD, worry management. Essentially, the videos are the same things that I talk about with my clients. I talk about the same models, develop the same understanding, and talk about the same skills and tools that I use with my clients in session, but just sort of putting it out there for anyone if they're interested in learning more. You can also find the videos at psychologyvideos.ca as well. The Anxiety Canada website is an exceptional website for information about anxiety and anxiety problems. It's got lots of self-help resources, self-help strategies, worksheets, videos, booklets, a whole bunch of stuff. So if there's anything you want to know about different anxiety disorders or anxiety conditions, I strongly encourage you to check out the anxietycanada.com website. I focused a lot of this presentation on anxiety and depression because that's the area that I work in. But the BC Partners for Mental Health and Addictions website, heretohelp.bc.ca, this is a really good website with a wealth of information on a range of topics. So it's not just about anxiety and depression, it's kind of more broad, pretty much any sort of mental health conditions, mental health issues. So there's lots of resources there at the Here to Help website. And finally, one that's specific to men, headsupguys.org. This website is specific for men dealing with issues of depression and mental health. So resources and information if you're wanting to learn more about the specifics of mental health conditions and ways of supporting men dealing with mental health difficulties. So that's pretty much all I had to talk about today. If there's questions, I can answer any questions that have come up.